Hi dear friends, this is 𝗖𝗵𝗵 Sutra going on, and yes, we are in central nervous system classes. We are discussing class 2 that is related to chronic meningitis. Chronic meningitis has got organisms like spirochetes, like Lyme disease, tuberculosis and tetanus. Now, tuberculosis we have already discussed, tetanus we have already discussed, Lyme disease we have already discussed, if you remember, Borrelia burgdorferi. But if you are preparing yourself for this exam of chronic meningitis of central nervous system, these topics are there, the link of which will be provided to you in description. Please don't forget to watch them. Now, we will discuss and learn about spirochetes. Spirochetes for that matter are of three divisions further. One is the Borrelia, Leptospira and Syphilis. Borrelia burgdorferi we have already discussed, where I was talking about Ferrari car a lot. Leptospira interrogans I have already discussed, yes, the rat, the rain, the swampy fever, and now comes the syphilis. Although syphilis is more of a genital tract topic, but please remember there is a syphilis which is called as neurosyphilis, and because of the presence of this neurosyphilis, this topic becomes of a vital importance if we discuss about the CNS examination of the CNS infection. So, my dear friends, starting with the syphilis now. But since it is very important in genital tract infection, we will mention it in the title, and there I will share the link of this video only so that you can come back here and see this. Syphilis is the disease, and the organism which is responsible for causing this disease is called as Treponema pallidum. The organism which is responsible for causing this is called as Treponema pallidum. Now, there are different strains of Treponema pallidum, but the most important strains are Nicol and Ritter. My dear friends, one very important thing I would like to bring into your notice, that Treponema pallidum belongs to spirochetes, and we have already discussed about spirochetes in the video where we have discussed about the Borrelia, the Leptospira. So, even if you do not want to watch all the video, just look at the introductory part of the spirochete, because all of the spirochetes have some common features which we have already discussed in those videos. So, the link will be provided in the description. Please go and have a check of them. Coming back to the Treponema pallidum now. So, Treponema pallidum has two stains. One is pathogenic called as Nicol stain, other is non-pathogenic called as Ritter stain. Okay. So, Nicol one is pathogenic and non-pathogenic is Ritter stain. Now, Nicol is something which is non-cultivable. The cultivation of Nicol is very difficult. That is why we take the testicles of rabbit and then cultivate the Nicol stain of Treponema pallidum. Whereas, the Ritter stain is the cultivable one which is cultivated in Smith-Noguchi medium. Alright. So, non-pathogenic stains can be grown in the Smith-Noguchi medium. So, please remember, my dear friends, very simple thing I am trying to tell you, that the one which is called as Nicol is starting from the letter N, that means it is non-cultivable. So, you cultivate in the testicles of the rabbit, whereas you have got one more that is called as Ritter stain. Ritter stain is something which is cultivable, and because the Ritter stain is cultivable, we are, so PQRS, R and S come together, we are going to cultivate them in the Smith-Noguchi. Okay. But please remember, Nicol is pathogenic, okay, whereas Ritter is non-pathogenic. Okay. So, how to remember? Ritter is right for your body. Ritter is right for you means they are non-pathogenic, whereas Nicol is not right, it is pathogenic. How syphilis is going to get transmitted? By the sexual route, so it is a sexually transmitted infection, by the blood transfusion, and mother to child also. That is why there is a concept called as congenital syphilis. Like the all spirochetes, they are not going to take the gram stain. That's why we use the silver staining and the Fontana stain for what? For the spirochetes, and the disease is called as syphilis. How these are seen? All the spirochetes, they are spiral, they are thin, they are delicate. So I knew that you are not going to go back to the syphilis and see the the spirochete video and see. So I've written all the important points here, but still I recommend just go watch it for a minute. I'll be very happy. So these are spiral, thin, delicate, all the spirochetes. They are not seen with the gram stain. That's why we give them the silver stain, the Fontana stain, the 𝗲𝗵 stain. They have got an endoflagella. That means the flagella is going to come from the periplasmic space. And the periplasmic space I have discussed in the video where I have discussed about the cell wall, the very first video you can watch. And that's why they have got a corkscrew like motility. I know it is something difficult without picture to visualize. Now see here. So all the spirochetes are spiral ones. All of them have got corkscrew type of motility. All of them are seen in dark field microscopy. That means the background is dark and they will be seen like this, dark field microscopy. Alright, they have got endoflagella, the portion which I have already discussed with you, so I am not going to repeat again and again, as we have to make the videos smaller also for better retention. Coming on to cultivation. Alright, so these things we have discussed. Yeah, coming on to the clinical stages. So there are different stages of this disease. First of all, coming on to primary syphilis, that is the hard chancre. Now you will comment down in the comment section and tell me which is the organism responsible for causing the soft chancre. Okay. So my dear friends, primary chancre or the hard chancre syphilis is going to cause. Actually it is just like a button. So if you press the button of your t-shirt, the consistency is button like, and I am sure you will have no pain if you press the button, right? So basically these are painless one, indurated ulcer, right? But please remember it is highly infectious and associated with local lymphadenopathy. Highly infectious and responsible for what? Responsible for causing the highly infectious and local lymphadenopathy is caused by them. Okay. So remember this, you can remember like this, 𝗵𝗵𝗵𝗺. So H and L are going together, that means hard chancre plus lymphadenopathy, that is going to occur both in the primary syphilis. And yes, it is highly infectious, that also you can remember with the H. Now secondary syphilis, you very well know I teach like this only, this is my way of teaching, MNOPQRST. So S for secondary syphilis, S, then R for rash, okay, rash occurring over the palm and sole. Coming on to M for mucocutaneous lesions, okay, or you can say maculopapular rash. So mucocutaneous lesion or maculopapular rash which are there. And yes, L also comes near the M. So what is L? Condyloma lata. It is not condyloma acuminata. Condyloma acuminata is not there. I am talking lata. Please remember, lata is there which is seen in syphilis and not the acuminata. Even for now you can forget acuminata, not important. So there is a mucocutaneous lesion. Mucocutaneous means, for example, lip is a mucocutaneous junction, cervix is a mucocutaneous junction, okay. So responsible for causing a type of mucocutaneous lesion that is called as condyloma lata, which is a moist, a flat and highly infectious. Till now it is highly infectious. Earlier that chancre was infectious, now this mucocutaneous lesion is also very infectious. Yes, it is associated with generalized lymphadenopathy. So in primary there was a local lymphadenopathy which was there in primary, whereas in secondary you have got a generalized lymphadenopathy. And yes, of course, the fever and malaise are going to be there because it is nothing else but what? It is a infectious disease. Coming on to tertiary syphilis, remember important thing, tertiary means now it is going to start to enter into the organs. Just like if it is going to cardiovascular, it is responsible for causing aortic aneurysm. If it is going to have neurosyphilis, responsible for causing the 𝗲𝗵s dorsalis and paresis. So, neurosyphilis means very simple, 𝗲𝗵s dorsalis. So, what is 𝗲𝗵s dorsalis? Obviously, the medicine faculty will teach you 𝗲𝗵s dorsalis in a very much better way, but as of now just remember that neurosyphilis has 𝗲𝗵s dorsalis. So, that is a neuronal lesion which is going to happen, right. So, tertiary syphilis is having the CVS involvement and the neurosyphilis also. The 𝗲𝗵s dorsalis, obviously the medicine faculty will teach you in detail. It is also responsible for paresis and yes, an ophthalmological the involvement also, which is called as what? Argyll Robertson Pupil. Argyll Robertson Pupil, that is a faculty of ophthalmology will teach you. Let us see who is the faculty who is going to teach you ophthalmology. But anyways, as of now this is important, and tertiary syphilis can even go to latent syphilis. Tertiary syphilis is capable of causing the latent syphilis, also called as syphilitic gamma. That means there will be aggregation of antigen and antibody. Antigen, syphilis, Treponema pallidum is having the antigen and there is antibody being formed. So, this is supposedly Treponema pallidum antigen and there is antibody being produced. So, there will be antigen antibody aggregation and this will be like a lesion that is called as syphilitic gamma, latent syphilis. Coming on to congenital syphilis, early and late presentation. Early presentation in syphilis, they have got snuffles, the rash and the bony lesions. Just remember, I will give you the description in the image format also, but remember early it has got snuffles, it has got rash, it has got bone lesions, and in later parts it has got a Hutchinson's triad where it has got a Hutchinson teeth, interstitial keratitis, deafness and of course saddle nose which is going to be there. So, what is Hutchinson's triad? Triad is consisting of three parts, that is this is having the teeth, the keratitis means the eye infection and of course the ear infection. So, eye infection, ear infection and the dental infection. So, Hutchinson's teeth. Okay. So, how to remember? I do not know if you have heard this story or not, but we always used to say that Gandhiji had three monkeys. One used to say, don't hear bad words, don't look at the bad things and don't speak bad words. Okay. So, those three words are the ones which you have to remember while remembering this syphilis. That means Hutchinson's teeth, don't speak bad words, interstitial keratitis, don't see bad things, then deafness, don't hear bad words, and of course nowadays don't smell bad things also. Okay. So, saddle nose is also going to be there, and yes, there is an eyebrow is just like Olympian brow. These are some things important. Now, what is Hutchinson's teeth? The molar tooth are mulberry like, they are serrated, mulberry like serrated teeth. Now, I know people are getting very anxious, sir, show us what you are trying to tell. Okay. So, see here, can you see the molar tooth which is getting mulberry type? So, this is the molar mulberry tooth, this is called as Hutchinson teeth. And then bony lesions, can you see how the bones have become in syphilis? Yes. So, these are the bony lesions in the syphilis which has happened. This is also Hutchinson's teeth. Hutchinson's teeth means they have got serrations. Okay. So, normally this is the teeth, now they have got serrations. Okay. So, serrated teeth. Yes, eyes also it has got, syphilis has got the keratitis, that is the inflammation of the cornea. Okay. This is the disfigurement of the face, if you can appreciate, this is called as regedes. Okay. The regedes are the facial disfigurement which is going to happen. Okay. Yes, and these pictures I have shown you. Yeah. So, this is a gamma, syphilitic gamma which is happening. Okay. So, syphilitic gamma means there is aggregation of antigen, there is aggregation of antibody which has formed, and you can clearly see the syphilitic gamma. Okay. And of course, condyloma lata, these are the flat lesions which you can see in the anogenital area, can be seen, it can be seen over the hands also, right. Yes. And of course, this is the chancre which is there. Okay. So, remember hard chancre I told you. So, this is the hard chancre which is there on the shaft of the penis. Okay, you got it? Good. So, yeah. So, I have discussed the various stages. So, how will you diagnose it? I have told you dark field microscopy, corkscrew motility or direct fluorescent antibody testing is something which is done for syphilis. So, from D of dark field microscopy, you can remember direct fluorescent antibody also. Staining for that matter for all spirochetes is the silver stain, Fontana lividity, and 𝗲𝗵𝗵𝗴𝗿 also you can use, no problem. Now, serological tests are very important. Please remember, you must have read about VDRL, venereal disease. So, venereal disease is something which is sexually transmitted infection. So, venereal disease research laboratory testing, VDRL. Then you have got rapid plasma reagent, that is also another test, and trust is also a test. Oh my god, that is very philosophical. Trusting your partners is also a test of your patient. Oh my god, trusting your partner is also one of the factors of your patients. So, what is trust? Toluidine red unheated serum test. So, remember, all these things are the test which you are doing in general. These are not specific for Treponema, because the ones which are specific for Treponema has got Treponema word in them, like 𝗲𝗵𝗵𝗴𝗵𝗺. So, fluorescent treponemal antibody absorption test. So, T is there, T for Treponema. 𝗵𝗵𝗶𝗶𝗵𝗵𝗺 Treponema pallidum hemagglutinin assay or particle agglutination test, again T. TPI Treponema pallidum immobilization test, and of course, ELISA is also Treponema specific, whereas the trust, the RPR, the VDRL, these are non-specific, okay, non-specific one. And of course, you can do the IgG, IgM, ELISA, PCR, everything, right. Now, VDRL, although it is a very trustworthy test, but yes, sometimes false positive results can be there in pregnancy. Sometimes they give false positive results. In SLE, some people suffering from SLE might also be positive for syphilis. So, that is a false positive result. And in fact, the viral infection, some of the viral infections are also going to give result as if VDRL is positive, okay. That is why, you know, VDRL is just a screening test. It is not a confirmatory test. It is a screening test, because the specific test is the treponemal test used to confirm the diagnosis. What is the drug of choice? Drug of choice for syphilis is penicillin G. For neurosyphilis, it is the aqueous penicillin G. Why aqueous? Because it has got a good blood-brain barrier penetration. So, good blood-brain barrier penetration is there. That is why neurosyphilis is important, because we give aqueous penicillin G. In congenital also you give penicillin, but if the patient is allergic to penicillin, then you have to give 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏. In fact, the adult patient may you can give, in adults patients you can give, in non-pregnant females you can give 𝗏𝗏𝗏𝗏𝗏. Okay, you can give the 𝗏𝗏𝗏𝗏𝗏𝗏. Mind you, 𝗏𝗏𝗏𝗏𝗏𝗏 has a side effect which obviously the pharmacology sir or madam will teach you, that 𝗏𝗏𝗏𝗏𝗏𝗏 causes chelation of calcium. So, because it causes calcium chelation, the teeth shows the malformation. That is why it is not given, especially in the children and in the pregnant females, right. So, what will you do if there is a pregnant female? So, you can give penicillin, but for example, if she is having allergy, pregnancy with allergy, then what you will do? So, pregnancy with allergy, you will desensitize, okay, you will desensitize with the different desensitizers. That means she will not be allergic to penicillin, and after that you give the penicillin to her. So, I think these things we have discussed. Yeah. So, yeah, this is my importance, this is my speciality. Whenever I teach, I always make comparisons, because comparisons, if you are clear in your mind, you are less confused, okay. So, now we will compare 2-3 things. One is called as primary syphilis or the chancre, okay, primary syphilis or the chancre, and that is to which chancre? Hard chancre. Then you have got lymphogranuloma venerum. If you remember, this is by the chlamydia, okay, by the chlamydia lymphogranuloma venerum is happening. And next is granuloma inguinale, that is by the Leishmania donovani, okay. So, as the name is telling you, please understand, primary syphilis is painless but has lymphadenopathy. there is ulcer which is going to be there. Lymphogranuloma, that means there is granuloma formation, that is granuloma formation is there, but it is unilateral lymphadenopathy. That because see the lymphogranuloma, venerum, ven means on one side, so one side means unilateral, so unilateral lymphadenopathy. Of course it is going to be painful, yes, and single papule or ulcer is going to be there here also. So what you have to keep in mind, that everyone will have ulcer, everyone will have lymph node, everyone will have pain except a few. Like for example, 𝗏𝗵 has ulcer, 𝗏𝗵 has lymph node, but 𝗏𝗵 does not have pain, so it's painless. Chlamydia, it has got ulcer, it has got lymphadenopathy, it has got pain, but lymphadenopathy is unilateral. Similarly, leishmania, it is also going to have ulcer, okay, but there is no lymphadenopathy which is there. And one more thing, very important, please remember, leishmania bleeds on contact, okay, it bleeds on the contact, okay. So I think this is clear. This picture I have shown you, these pictures I have shown you, these all things are clear, yes. So now we are closing this session because all the important details I have given you. Still, if you have some doubts, some queries, you can drop down in the comment section, right? So thank you so much for joining in, and I hope that things are making sense, things are being registered within your 𝗵𝗵𝗵𝗵 circuit, and you are doing good in microbiology nowadays. Thank you so much.